Thank you. Thank
You're
you.
welcome.
Uh, this is Thelma Craig, and I am with the Colorado Black Health Collaborative. I'm the chairman of the board of directors of the Black Health Collaborative. We're a nonprofit community-based organization. Our mission is to achieve health equity in Colorado's Black community. Our motto is we want to be the healthiest Black folks in the nation. This is our season. This is our new session, Real Talk Menthol Moments Spotlight. We will interview a number of members of the community throughout affected by menthol smoking, and who are affected, like within their families, smokers, family members of smokers, and the community at large. So stay tuned and find out when we'll have these sessions. We are tackling menthol in the Black community. This Real Talk is brought to you by the Colorado Black Health Collaborative, and we hope to be informative and enlightening. Today, I will have a real talk discussion with Johnathan Miles. Johnathan is a former smoker, a coach for the Colorado Quitline, and has lots of experiences, and he's advocating in the community to get the messages out. Smoking tobacco and the overall effects and how it really impacts us in our community. He has a wide range of knowledge about the social justice issue, but he was a former smoker. So we're going to talk to him today. But first, let me tell you a little bit about what the Colorado Black Health Collaborative have been doing this year. One, I mentioned we're working on the tackling menthol and other flavored products in the Black community. This is our third year in this project to address focused marketing that results in more Blacks smoking menthol flavors and dying. We are educating the community. We hosted 2 webinars this year to inform and engage the community on this issue. We will use this feedback that we receive and really develop the strategies, come together with the community and develop strategies on how to combat this issue. We're currently working on the COVID-19 epidemic. We have a free mask distribution campaign. We're working with Denver Public Health to meet the needs of the Black community in Denver and how they're impacted by educating them about COVID and really giving them some culturally responsive answers and how they can take care of themselves. And we're going to be talking more about the vaccination. We're providing resources and information to the community to assist them with the COVID-19. We also have an ongoing communication campaign to really talk about Black health. Okay, the collaborative is in our last name, and we want to thank our sponsors, the Colorado Department of Public Health and Environment. I worked at the Department of Health for 30 years, where I had the opportunity to serve the community, and that's my passion, and that's what I continue to do. So let's get to Real Talk with Johnathan Miles. I've already introduced Johnathan, and I want to thank you, Johnathan, for being here and coming on and talking with me and answering some of my questions, but to have a real talk and discussion about smokers, as a former smoker, and we may get into some of the work that you're doing. But my first question to you, Jonathan, first of all, how are you doing?
I'm doing well. Thank you for asking.
Jonathan had to have his wife fix his camera, so he was he might be a little off kilter. That he has no shame in that. Thank you, Jonathan. Thank you, wife. So, Jonathan, tell me the first question: how long have you been tobacco free?
Roughly now 6 years.
Very good, very good. That's a wonderful milestone. We appreciate you answering that. Tell us your earliest memory of tobacco products and how that may have influenced you to start smoking. How old were you? Just how did you have family members involved? Just tell us your earliest memory of tobacco products and your family.
Oh yeah, sure. Because of the generation that I'm partly part of, I was, when we're growing up in the 70s, late 60s, everything was still pretty much open. So you could smoke in houses, you can smoke in cars, you can smoke in hospitals, airports, airplanes. So my dad, not parents, my mother doesn't smoke at all. My father smoked. So ashtrays were around the house. Friends who came over of his smoked, other family members, aunts, uncles, they smoked also. So being around smoking especially in the that time period, that 70s era, was prevalent because you'd be playing in the street as a kid, and
Mhm.
as you ride your bike, look next to a car, and there's a little pile of cigarette butts because they dumped the ashtrays out the window.
Wow.
You go over someone's house, the ashtrays were strategically around the house, and it was always near the seat of whoever smoked, and there'd be a little pile, and it was probably one of your jobs as a kid was go dump the ashtrays, so you're
Right.
used to it.
Right.
But yeah, so growing up, it was I liken it to being a child of in a rural area who grew up around hunters.
Mhm.
There's something dangerous in the house.
Mhm.
You know it's there. Your parents know it's there. Grandparents know it's there. For hunter kids who grew up with hunting, there's a loaded weapon in the house. You as a child never touch it ever, other than go hand it to someone. Um, with cigarettes and or tobacco goods, they were there. I was even here in Colorado. I can remember actually going to the store for my father to go buy his cigarettes
Mhm.
as a what was I probably like in elementary school still, and the grocery store people not having a problem handing you the pack of cigarettes because they knew that you were there for your parent. You get them, go back home, give them their cigarettes, probably try to keep the change and go on about your day. Uh,
Yeah, I had that same experience, with some of my grandparents smoking and sending us to the store on the errand, on the smoke run, the snuff run,
exactly.
pick up the tobacco chew. So
Yes.
it was inherent in those households. With us at an early age, we were probably in that same era. So yes, I can appreciate that story.
Yes, ma'am.
So
And and it's good. It's what was the time period then was acceptable.
right, right. But we're trying to be healthy. We're trying to bring about this consciousness. But we know, and we'll talk about how we were actually influenced and marketed to for
Hmm.
smoking. So we're
Yes.
gonna get into that. But tell me, um, do you remember if you were attracted to a certain brand, or do you remember the brands that your grandparents and family members often smoke, and trying to find what memory do you have in the purchase of what brand of cigarettes?
Oh yeah. My father, he smoked Cool Filter Kings.
Menthol.
Um, that was his cigarette of choice. My uncle, who I would be over his house with my cousin, who was a year older than me, he smoked a pipe. So it came in a blue tin, a big tin of tobacco, pipe tobacco.
Mhm.
It had a cherry wood flavor. I can remember because you hear him tapping this pipe on the side of his tall ashtray all the time.
Mhm.
It was just that was a brand, and there was brand loyalty. So you very rarely ever saw anyone who smoked a certain brand
Mhm.
ever smoke another brand.
Mhm.
Over time, my father, who smoked, uh, switched from Cools when I was young to Camels,
Mhm.
unfiltered,
Mhm.
um, where he no longer smoked the menthol flavor, but he no longer used the filter. So that was probably for the last 40 years of his life.
And
He did
that
that.
filter, in the menthol cigarettes had that cooling sensation,
Oh
and
yes.
the black folks in the community, oftentimes admitted that because of that cooling sensation, that gave them some relief in the throat, in the care of that. And then, remember they were also using vapor rub because of that cooling sensation. There's
Hmm.
something about the cooling sensation that eased the harshness of menthol and
Yes.
mentholated products. So
Right. And menthol that's the main thing of menthol. And anyone can go look on the CDC sites and see what menthol does. Menthol is a cooling agent that takes the harshness out of tobacco, so it makes you breathe deeper. So you inhale deeper into your lungs and hold it. Uh, the irony is, in North America, all tobacco products have menthol in them.
mhm,
So what happens to the black community, and since that's where we're focused on,
mhm,
is the push is for I won't say the brand name, but they come in red and green. red is the traditional, green is the menthol. The menthol is pushed on the Black community because they found that Black people like that cooling sensation and will breathe deeper. But their studies in the CDC show that there's no significant difference
Mhm.
in how much menthol is purchased over non-menthol. It's just that you marketed this toward the Black community.
Yes,
That's what they're going to buy.
that's what they did. Let me ask you this personally, because you were a non-smoker. Why did you choose the brand you chose? And what brand did you smoke?
Oh, actually, the irony is I actually didn't smoke cigarettes. I smoked cigars.
Hmm.
And I, like so many people who did smoke, you experiment different styles. I smoked cigarettes at one time, didn't like them. Did chew for a while, didn't like it because you got little leaves on your teeth and your breath is bad. Didn't I tried using the pipe with, but then you're like packing it constantly. You got to carry an extra pouch. I actually settled on cigars because of movies.
Oh,
I happen to be a movie buff and I like old film noir detective
the look,
films, and all the gangsters have cigars.
the
So
look,
it was
the
all
image,
look cool.
the image, and that was one of my questions. Why were you attracted, to what you smoked? And you just answered that. It was the
Yes.
image on TV, and really that's how their marketing they have a strong marketing campaign to the Black community on smoking. The look, you see the glamour. You remember the Jet magazines and the Ebony magazines on the front pages and all throughout the magazine. It was the glamorous Black people holding a cigarette. So it really is about the image. How many times did you try to quit before you quit?
Actually, I didn't ever try to quit. I am a person who was never really a chain smoker of any kind. Like
Mhm.
I could literally smoke a cigar every day for a year and then to get bored and not pick it up again for months on
Mhm.
end. And this just happened. I stopped because one, I got tired of getting uh, colds and the flu, and it really bothers your respiratory system when you're smoking
Mhm.
a cigar.
Yes.
So you get those viral infections that you're like, how did I get this? It's because
Yes.
you
Yes.
weakened your system. Yes.
Yes, and that's why there's that intersection between COVID-19 right now, and smoking. There's an
Yes.
intersection, and it's even more challenging for smokers with COVID, and getting the disease and really helping to come out and be cured and really recover. Let me ask you this. But you said you were kind of in control, so
Hmm.
questions how many times you try to quit is not really necessary then.
Right. Literally once. When I tried to quit was 6 years ago, and it also coincided, ironically, with starting to work for National Jewish Hospital, where you can't be a smoker and work there. So kind of needed the job, and I was like, maybe I should stop.
That's
So I
probably
stopped.
that's environment and policy change, and that's really how they
Yes.
help people to really control their smoking. Do you remember, like I was mentioning, you
Hmm.
said that you remember those ads and those tobacco
Oh,
brands,
yes, yes.
because we were targeted, and it was everywhere. And I'm sure it was everywhere for our parents and grandparents. And it's really powerful, the tobacco companies, how they really market, especially the cool. They talked about the cool jazz festival,
Hmm.
just the glamour of cool and how they made it cool. Can you speak on something about that and talking about the how the tobacco industry really tried to influence the Black community with the advertising?
Oh, yeah. From my standpoint, growing up, as you stated so nicely or eloquently, was the Jet, the Ebony magazines, and you would have not only the attractive models, you had the most attractive actors and actresses,
Mhm.
and um, you would see them, the Billy D. Williams holding a cigar or a cigarette, and whether he wasn't doing the beer advertisements, which is a whole nother subject you guys can tackle later. Uh,
We have a lot of work to do.
yes. You also saw a lot of the female actresses on Virginia Slims and using those and the extra long cigarettes and how sophisticated you
Sexy
would
look,
be.
sophisticated, sexy.
Exactly. And I even at one time with one of the companies, small companies that I was working as a owner, co-owner, myself and my friend, we owned a sports and design company
Mhm,
back in the early 90s, late 80s, early 90s. And we were on the Virginia Slims tennis circuit.
mhm.
And so we're being sponsored. Everyone there is sponsored by the Virginia Slims cigarette company. So you're on, and we had the summer run. So they would give you free products if you wanted it.
Mhm.
Um, Luckily, I wasn't smoking cigarettes, but to sell our goods, we also had to have put their logo on our sports stuff
Mhm.
and tennis.
Marketing.
Yeah,
And
and
there was a time when they came through the neighborhoods and they were giving out free cigarettes and
mhm.
to the community, and that really started a campaign. Why do you think they targeted us? I think we mentioned something about that because the menthol in particular, because of the cooling sensation. Why do you think they targeted Black people um,
Oh,
to smoke menthol cigarettes? Well,
personally, my
after doing all the
opinion,
research. Mhm.
yeah, personally, my opinion is really boils down to the same reason we're being targeted again. It's income. There's probably back then there wasn't billions, but there was hundreds of thousands, if not millions of dollars of Black dollars, and they want them. And this is just my opinion. The tobacco companies don't care whether you live or die. They really don't,
It's about
because they
money,
know, huh?
menthol. I said
Yeah,
money, menthol, marketing, manipulation. But go ahead.
yes, and they know once they have you buying their product, they know that you will have a health issue, and not just a cold, a major health issue, emphysema, chronic bronchitis, COPD. You will continue to use their product as it's killing you. And they're marketing not necessarily to you and I, they're marketing to the elementary school and junior high and high school kids
Mhm.
because they need them when they get of age to buy these products to already have it in their mind. They're okay to use. Look, you've been using it for this long. It hasn't hurt you. Look at these cool flavors we have on top of them being menthol. So the menthol itself is, it turned out that the Black community preferred that menthol hit because tobacco is a bitter plant. Um, and the more menthol they put in, the more receptive the Black community was to using the product. So if a little's good, a lot is great.
And there's
And
studies. There are a lot of studies that show, and if you go to our website, audience here, you can see articles that we talk about how the money, how we were manipulated and marketed to, and why, and reasons. And the research is amazing, and how they really look back to see how we were truly affected by that marketing strategy and manipulation. But I'll also want to bring the attention to you and the audience, and I know you recall this video by the Truth Initiative, Black Lives, Black Lungs. And
yeah,
really, it answers everything that you want to know about targeting the Black community in menthol cigarettes. Money, menthol marketing. I mean, it's really all about the money and how they utilize, the trends, utilize us even in the campaigns, to target us, So we really have a lot of work to do. We're not here on our project that we're working on to judge anybody in smoking. We just want to bring about awareness and talk about the historical campaign, that has been, targeting our community to keep us smoking menthol. And then what percentage of Black people are dying from lung cancer? Black men are the largest population that are dying from lung cancer. So we want to express all of these things, but I have another question to ask you because there's so much in that topic about manipulation in the money and manipulating the community and our psyches about continuing to smoke menthol cigarettes, because a large percentage, I think it's 95% of Blacks who smoke cigarettes smoke menthol. And
yes.
so, that's what we're talking about here today. And we're trying to tackle this issue and talk about it and bring about that awareness. Let's see. When did you realize that you were a smoker and that you had to be challenged in stop smoking? You said that you were kind of saying you were more in control of your smoking habit. You can stop.
Yeah. I realized that I had to be classified as a smoker when I was in college at Metro State downtown, because you could still smoke on campus when I went there. And my cousin and one of my friends and I one day were sitting outside in the student union. We were just right outside the nurse's office, acting silly, not going to class like you're supposed to. And for some reason, we had cigars with us, and people could smoke out there. And I just wanted to see how much smoke we could put in this room before they made us leave. So
Mhm.
we literally just kept lighting cigars. Just
Wow.
we filled up the hallway, and were asked to go outside, uh, for being, not because we were breaking any laws. There's no rule that said we couldn't do this.
Well,
It
you know,
was
that was a major
okay,
campaign to stop smoking, but
right.
so you were smoking in a building at that time. Had
Mhm.
they started that public awareness campaign about smoking in buildings?
No, it was right. It was like a year and a half, 2 years before,
Oh, okay.
because the following year is when they banned smoking on campus and
Mhm.
in buildings. They started taking ashtrays out. All the smokers were mad because they had to go down to the corner and stand near the sidewalk and smoke, or smoke in the bookstore where I was working at the time. You had to go out to the dock area, and you
Mhm.
could smoke out there
Mhm.
with the car fumes and stuff. But
Yeah, that was a real powerful campaign. They started with, with the quit smoking. Now, you being a Quitline um, um, smoke
supervisor.
supervisor of the
Hmm.
Quitline, that really is a huge job. And I remember coming to your facility and talking with your group about being culturally responsive in tackling and talking to Black smokers or people of color that smoke,
Yes.
how there's a different approach when coaching and really providing services to us and helping them, supporting them in quitting. And do you think that why you think that, is that because of a stigma of smoking in the Black community, that we don't seek as much help, and or we're not as receptive to the services that the Quitline offer? I remember when talking with that group, that was really a challenge, that we as Black people are not as um, accessing that service as much. And when we
Right.
do, there should be just different how to be culturally responsive in providing that service. What do you? And let's talk a little bit about that as you as a Quitline coach and supervisor in your area.
Okay.
Talk a
Yeah,
little bit
no
about
problem.
how the Black people are receiving your services or not receiving the services, or how you want to make sure that we are being culturally responsive when we're talking to the members of our community.
Yeah, no problem. The first thing that we run into is, the average Black American that we talk to, Black Coloradoan,
Mhm.
uh, has a stigma of health care in general. And now we're talking about tobacco products, menthol tobacco specifically. One, no one markets typically to them to say, this is bad. This is bad for you. What they're marketed to is how cool you look. Look at how, and we keep talking about this, the marketing manipulation of the people, of us, is, don't worry about your health. Look how cool you look. And when you have that problem,
Mhm.
it's really difficult to get the mindset of, you need more than just nicotine patches and gum and lozenge to break you of this habit. This is an addiction, but it's not presented to you as one through the health world. One, go to the doctor, please. Everyone out there, set up an appointment if you haven't, and go to the doctor and talk to them. If you smoke, definitely. And find out, one, you're in Colorado. We're a mile above sea level. The air is thin already. If you have any other underlying health issues, diabetes, hypertension. These things are compounded by smoking.
Mhm.
But people want to continue because they believe the myths. One, smoking relaxes me. Like, no, it really doesn't. If those studies are already out there that says it constricts your blood vessels, it heightens, it gives you almost like the jitters, because your endorphins are kicking in. You don't you tend to lose weight because it shuts down your appetite. So it's an appetite suppressant in a lot of cases for people.
Yeah,
It's
because
not
I hold
healthy.
that thought because I heard that when people try to smoke, they stop smoking. They say they gain weight.
Yeah,
Why would they want
they
to gain weight? And then
right.
you got to tackle the weight issue. But
Yes, ma'am. And they have, but the weight issue typically was already there. The bad eating habits were already there. Uh, when you stop smoking, it just means now you have there's a there's a motor skill uh, issue that people have when they quit smoking that they don't think about. You think about, well, I have cigarettes. Oh, I have to figure out I can drink some water. There's a hand movement
mm-hmm,
that you do, and people have rituals. And
mm-hmm,
one of the rituals that people have is whenever someone who uses tobacco, menthol cigarettes, what have you, how you take the pack of cigarettes out your pocket, how you pack the cigarettes, because everyone's seen someone gab them in.
yeah.
Exactly. You tap them, how you pull it out the pack, how you hold it, how you light it, which way you tilt your head. You will always do it the same way. Where you put your lighter, and then you start smoking. Now it's repetitive motion, mouth, mouth. And you got to think, okay, 20 cigarettes in a pack. I'm smoking 10 to 12. We'll just say those numbers, just 10. So it's half a pack a day.
Mm-hmm,
What people don't think about is how many repetitive motions did you do per cigarette?
mm-hmm,
Now equate that to working out. If you were to go to the gym and do repetitions of an exercise, that's the same thing.
mm-hmm.
Repetitive motion, hand eye coordination, or motor skills, whatever you would like to use, but it's unconscious movement. And then you go about your day. When you smoke your cigarettes, almost guarantee everyone who is a smoker, a real smoker, the exact same time period without looking at a clock, they'll smoke their cigarettes all the time.
Mm-hmm. Wow.
And they're triggered sometimes by visual things driving to work. There's a certain point, boom, start lighting your cigarette. Oh, this is a horse. I hate this stretch of road.
Wow.
Or, I'm in traffic, you know.
Wow.
So,
And it sounds like you know a lot about those really intricacies of a smoker, and what they do, the behaviors. When you
mhm,
get someone calling into the quit line, what is your most important or your first, or what's the most significant question or statement you make when you get that African American or that African American or person of color caller about smoking? What is
um,
the main statement you would make or question you would ask? That's a difficult
the,
question, but I just thought about
it
that.
is. What the hardest thing or the most difficult thing we deal with, and this honestly has no color barrier. It's
Mhm,
about the addiction. It's one, we're not judging you. This
mhm,
isn't, I don't have a smoking problem. So yeah, you have an addiction. We're here to help you along that road of recovery.
mhm,
And we point out to you there's no quick fix to this.
mhm.
If you are a true tobacco user and are truly addicted, there's no quick fix. It's not going to be 5 phone calls and you're cured. Go about your day. You'll never smoke again. All
Mhm.
it takes is one problem, and then we're talking relapse issues. We're talking slips. We're talking withdrawal symptoms. You have people who still believe that all I need is just to put this patch on my arm and I'll never smoke again. And we're like, we equate it to, yeah, it's like a heroin addict going to a methadone clinic. They're
Wow.
going to give you that methadone. Yeah, you may not want heroin again, but you're ingesting methadone.
That's a drug. So
Yes, you just have a new drug in your system.
That seems
That,
like really exciting work because, you're working with a person in their addiction,
mm-hmm,
but like I said, we're going to be talking about cessation with this project we're working on, the cessation and the resources and how to build up these resources and support the community, and stop smoking, but also bringing on that awareness. I think someone said in one of our sessions that, not only are we addicted to the cigarette, but once they realized we were targeted on these particular cigarettes, like a social justice issue, the Black
mm-hmm.
community was targeted, to smoke menthol cigarettes, and now it's an addiction, and so that's really kind of that, all those challenges. And people say when people realize that we were actually targeted as a people,
Mm-hmm.
it becomes a social justice issue, then that will get them kind of hyped up and say, wait a minute, we were targeted. We were really intentionally targeted to smoke the cigarette, and we're intentionally dying, a large proportion of us dying because of this menthol cigarette. That really, do you mention that to your clients when you're talking to them? That
Yes.
to bring about that awareness that, well, we were actually targeted, and it is a social justice issue.
We don't so much touch on the social justice portion of it, but we do mention to any of the Black participants that use us.
Mm-hmm.
Yes, we tell you that this was a targeted campaign,
Mm-hmm.
and there's a whole division in every tobacco company that focuses directly at you.
Mm-hmm.
I liken it to the old Public Enemy hip hop group's logo. It's a black man standing there in crosshairs.
Mm-hmm.
And that's exactly what you are. You can substitute the man for a woman, a child for an adult, elderly person for a younger person. And the tobacco company is firing menthol cigarettes at you.
But
And they
look at,
know,
I
go
get
ahead.
look at even like in slavery, or Dr. Richardson, the chairperson on our Colorado Black Health
Yes.
Collaborative, she liked to say, first they made us pick it, then they made us smoke it. And I think that really kind of says it all too. And like you
Mhm.
said, in hip hop, they're using some of those images to really convey that message. The tobacco company, yes, they are making a lot of money. And we were talking about stigma in the
Yes.
Black community. I have a question. Stigma. What about families that, because of that stigma, there are still families who's holding a secret that they have family members who smoke because of the stigma, because family members say, "What's that? You learn that lesson. What's happened in this house stays in this house," and the stigma build up around people, and then the family members start smoking, or the youth start smoking, and so it really, people would get to have a lot of fear and stigma around the smoking issue. And I think
Yeah,
that's something that could be talked about, even in the coaching area that you do.
yeah, and some coaches will pick up on the peer pressure, whether it's family members or friends. And for guys, I'll talk about black males, is that you'll have don't be soft. Real men smoke cigarettes. Real men can do blah, whatever that is. This is what you do, or that weird saying, this is how we do this.
Mm-hmm.
Smoking cigarettes, smoking the menthol cigarettes, is the smoking choice of black people. I've sat in rooms with the salespeople who are the representatives of tobacco companies when I was running nightclubs,
Mm-hmm.
that would be like, okay, in your machine, we need to have this many menthol cigarettes, this many plain cigarettes, this many from this company. We're pushing this product, so we're going to have this group of women come down who are scantily clad, passing out free whatever. I don't know. Some of your viewers may remember Joe Bucks,
Mm-hmm.
Joe the Camel.
The
They
camp,
had,
yeah.
right, and they had a whole campaign. They might even still be doing it, where they give you their dollars to
Mm-hmm.
buy their products, t-shirts, bags, tennis shoes, hats, uh, little carriers for your cigarettes. but it also keeps their logo prominent on it. So you always see Joe the Camel on there, and it's Camel cigarettes. You're like, oh, okay. Once
Marketing.
again, goes back to marketing.
Marketing.
And we're, yeah, in the manipulation of people. And you make a fun logo so that quietly you target children.
Exactly. And that's a real problem now with the vaping, and the flavors in the vaping. And that's
Yes.
another whole story. And we'll have you back on to talk more about that. And because I do want to find out, do you get the vape callers?
Yes.
At the line?
Oh, yes. Yes, they all summer, all since for the last year or two. Yes.
Yeah, I was reading where when they started vaping, most people who were smoking, they were told that to use a vape or jewel that can substitute for the cigarette to stop you from smoking. But what they discovered, what they didn't know was that that instrument, that jewel had as much nicotine in it as a pack of cigarettes.
Oh, if you're just talking specifically of the jewel, yeah. But the electronic nicotine devices, which are any electronic style stick or cigarette that looks like zip drives or little memory sticks, those things can have more than a pack of cigarettes worth of nicotine in them, because there's no regulations on how much they can put in them at all.
Yes, exactly. And speaking of regulations, and I mentioned earlier that with our project here at the Colorado Black Health Collaborative and talking about tackling menthol in the Black community, I'll ask you this question. Do you think banning the sale of menthol cigarettes in the Black community will help cut down on the number of youth and adult smoke? But first, let me say, there's a study done and they interviewed a lot of Black smokers, and they said they would quit if menthol was banned. Now, no big challenges, and sometimes you have a black market you go under, but do you think banning the sale of menthol cigarettes in the Black community will help cut down on the number of youth and adults who smoke?
Yes. That's a simple yes. It's the main reason would be if you limit the access to the favorable product that is consumed in the Black community, then it goes away. Now, as we know from years of dealing with the tobacco companies on whatever level we have been, if they lost that, there's something worse coming. Guaranteed.
To kill us.
Yeah, because that's revenue. They don't look at it as we're saving lives, because that's what the company I work for, that's what the Black Collaborative is doing. We're saving lives. We're getting you to think. We're giving you the education and the information and material to save your life from a very slow and horrific death, because that's what's coming typically from these products. But yeah, I would love to see them ban nicotine, especially menthol. The menthol cigarettes, the cigarettes in general, tobacco products would be wonderful. But
it's happening. It can be done.
Yes.
It can be done in San Francisco. And we're working with Dr. Valerie Yerger out of San Francisco, where they ban menthol cigarettes in the city of San Francisco. And she's working with a number of communities really addressing this issue, doing presentations and talking about it. There's so much information, and we're going to try to with these menthol moments, and we're going to have you back on too, because there's so much. But I'm talking about the policy changing, and environmental changes to really help us to address this issue, because it is a social justice issue, but it's a health crisis in our community, and it's been kind of silent. Because there's a lot of stigma around it. There's a lot of, because the tobacco companies use a lot of billions of dollars, to really market this, manipulate, and so it's in our faces, and we're really not looking at the real impact that it's having on our community. So, and that's why I appreciate you, Johnathan. Johnathan is a member of our coalition. He comes to our coalition meetings. The Colorado Black Health Collaborative has a tobacco tackling menthol in the Black Community Coalition, where we meet every other month. We have campaigns and, talking about this in our Zoom webinars, but we're going to tackle this more. We're going to increase, the level in which we work with this issue. And we want to bring on smokers. We want to bring on non-smokers. We want to bring on families have been affected. Did you, and we talk about families, and then in your experience, did any family members that you know, did they die or have any real complications from smoking? Because you said you start out young, that was in your environment, you know, the ashtrays. And so did you see anybody live with chronic illness because of their smoking habits?
Oh yeah, my father. He passed almost 2.5 years ago, 3 years ago almost. Yeah. He had chronic bronchitis and COPD. He had spots on his lungs. That was one of the main factors of his passing, but it wasn't the main one. But to see him still trying to smoke, and he knows he has this, that was an issue. So trying to talk to him about it, and he knew where I worked. So he's like, "Oh, well, that's wonderful. You should keep that job, John.
That's a good job. You got a good
I'm
job.
going out here and smoke this cigarette." I'm like, "Oh man, come on, Dad." And having uncles who smoked, all my uncles smoked. Many of my aunts smoked. Almost, yeah, I think I have one aunt left out of maybe 9 aunts and uncles who's still alive who were tobacco users at one time, and they've all had complications from it.
So
Great aunts. Go ahead.
that's in our families, that's in our communities. And you know, you can see, you know, systematically, historically, it really has affected the Black community with chronic disease. And that's why I mentioned you know, we want to work on this issue because it is a social justice issue, but we want to make our community healthy. You know, we want to change the narrative, you know, and not be disproportionately affected by, you know, every disease in the community. And but we were talking about tobacco and smoking, but it's really about health disparities, but it's a social justice issue. And I really encourage people or the listeners to listen to the YouTube Black Lives, Black Lungs, and you can really see, you know, just how over time things were happening. But you also saw some of our politicians and, you know, and community leaders really trying to address this issue, and how they would get pushed back, you know, because the tobacco companies had all the money to push them back. But look at that video on YouTube. Johnathan, we're going to have on once again because he is on our coalition, and he really supports us. We talk about smoking cessation because he is a coach for the Colorado Quitline for the National Jewish Center. We so appreciate you being here. So I'm gonna really kind of do you have any? Let me see if I have any other questions here that I didn't get. One question I think I want to ask: when you kind of smoked and you stop, do you currently now, and you working and ever have cravings for smoking? I just want to slip that in. I forgot to ask you that.
Oh, actually, no.
No.
Once I just happen to be part of that very, very small group of people, which is under 1%, that when I stopped, done. I had no cravings, and smoking cigars is a lot different than smoking cigarettes. Because I wasn't smoking like the Black and Miles. I was smoking actually the cigar that I smoked was Ashton's, and they were the Churchill gauge, so there's the super long ones. And the thing that made it a lot easier for me to quit was how much they cost. So when you're talking, one cigar is $30, and I had to get a box of 200. So
yeah, it's really
you're obligated to smoke them, but
and it's going
easy
up.
to stop.
Yeah, it's going up. And what I heard too, and reading an article and really talking with a representative from the health department, you know, they were saying how young Black students start smoking more at age 18. You know, when they really get older, where they really have a large percentage of usage at that age. And so the question was asked, and I think there's going to be more studies and more talks done about this. Why? And then I thought, because they have a job.
Yes.
You know, they are able to work and have a stable job, you know, and so that's really kind of changed, you know, the trajectory of Black students start smoking, youth.
Yes, and it is. There's, how should I put it? It's easy social study to do, because you just have to go to one of the campuses.
Mm-hmm.
And I guarantee you, every high school in Denver or in Colorado has a smoking section
Yes.
on that campus. Now, whether it's actually supposed to be, they're not. I went to East back in the day.
Mm-hmm.
And back then, the South Lawn was where the smokers hung out. So you knew jocks were up front, cheerleaders are up there, here's a little arch crew, what have you, blah, blah, South Lawn smokers. And you're like, oh, if you didn't want to be associated with the smokers, you just didn't go over there.
Right.
But if you wanted something, there you went.
Okay, Jonathan, as a coach, and
Mhm.
really being in the campaign to help people to stop smoking, what's most important to you about protecting Black youth and youth adults from smoking, from big tobacco and smoking? What's most important to you about this whole project and outlook and what we're trying to do? Is it policy change? Is it talking to individuals to work on their addiction? You know, what's most important to you? I know that all of it is important, but what's most important that you can leave this message from this conversation today so that we can encourage people to come back on and listen to what we're talking about this? What would you say to that's most important to you about this whole process?
I would say probably would be education, the education of health for yourself. Stop relying on someone that, and this is for the youth, stop listening to someone your age tell you that this is okay. Go research it yourself.
Mm-hmm.
That would be my thing. Self reliance.
Mm-hmm.
I know it's always been a stigma for young people to listen to older people.
Mm-hmm.
Always has been. They don't want to hear it. They don't want to hear it because it's like having your parents in your ear telling you to pick up your room or whatnot.
Mm-hmm.
Um, and you'll shut down. But also is I won't use that phrase because that's kind of rough. As one of my grandparents used to say it. But
Well, you know, sometimes we relate to that. If it's not a bad word, you know, like
yeah,
a
well,
profane
not
language.
really. It's not. It's just don't don't follow an idiot. Uh, a foolish person you know is a fool. Your friends don't know any more than you do,
Mm-hmm.
typically. But when they try to tell you why it's okay to do an electronic cigarette, and
Mm-hmm.
and you hear, because we talk to these young people who actually get combative with the coaches, and we have youth coaches that's only people that they will be dealing with are the under 17s,
Mm-hmm.
above 14 and under 17 who will be calling in or texting or typing or chatting with us.
Mm-hmm.
And it's trying to get them to understand you can't argue scientific knowledge with us because we're the group that's putting that scientific knowledge out.
Out there, yes. So
So where's your information coming from? It's coming from the internet. It's coming from their friends who want to use that product. And
mhm.
they don't want to use it alone. They want you to join in. So
I
they're going to tell you what to do and
I
you're going to listen. So mine is
edu-
education of yourself about your health.
I like that, Jonathan. And we're gonna wrap it up. And I want to ask you because we're really trying to get more people, you know, involved and engaged in what we're doing on our coalition. And we're not judging on smokers, non-smokers, families, you know, involved. What recommendations do you have for others or youth to get more involved in this fight against menthol tobacco products?
Um, for me, many years I did a lot of volunteer work in the elementary schools
Mm-hmm.
under different groups with different people from PAL programs on.
Mm-hmm.
My thing is, if you have the opportunity, if you have 30 minutes, 60 minutes out of your day, lunch hour typically for a lot of us,
Mm-hmm.
try to get to an elementary school and join in a program
Mm-hmm.
that talks to the youth. The elementary school kids are the main ones. For those of us who are older, you want those kids to get that information and see you. In the Black community, one of our biggest problems is that the only time a lot of the urban young Black children see professionally dressed Black men and women is on your way to court, in church, or when there's a lawyer involved. But there's doctors, there's of all styles of doctors. So you don't just have to be the surgeon or the typical white coat doctor. Any professional who looks professional should try to get over and be an example, a visual example. Military, come in your uniform. We used to do this when I was with the PAL program. 30 minutes during the lunchtime, we come and sit with you and talk to you for your fourth graders.
That's great. That image and really projecting that for our community so they can see those images so we can help change ideas and behaviors. And we really appreciate that. We have some, excuse me, young people in our coalition from the ASPA group. We want to expand the more youth participation and working with us. And, I want to close and really thank you for your input. And this conversation has been really enlightening, and thank my audience for listening. We're going to continue this once a month. We want, again, check out the Truth Initiative's YouTube video, Black Lives, Black Lungs documentary. And really it gives you that whole perspective about smoking in the Black community, the marketing, manipulation, and the money, and why that's all about it, but how it's really affecting us. And talking about policy change, check out our website, coloradoblackhealth.org, for articles and updates on what we're doing in this area and other areas, because our mission is to achieve health equity in Colorado's Black community. So join us on this mission. Like us on Facebook, like us on Instagram. We're on Instagram, and look at some of the other programs we have. And we're going to talk more about that, but we're going to have interesting guests. And we so appreciate you, Johnathan Miles. Johnathan, again, he's at the Quitline. If you want to talk to him and call in the Quitline and ask for Johnathan, he's a supervisor, so he might be really, really, doing, he might refer, but talk about it, call. And we're not here to judge. We're just here to bring about this awareness, education, talk about what we can do and strategize how we can do to support our community in this. So once again, Johnathan, thank you. And everyone listening, thank you for tuning in, and look for our next live stream video to talk about tackling menthol in the Black community. Thank you so much, Johnathan. Did you want to say one word before we go?
No, thank you very much for having me on. I appreciate it. And look forward to being on more. I enjoyed this.
Thank you very much. Okay. Bye, everyone.
Bye.
Bye-bye.